executive session. For those of you that didn't pick up on it, we decided to cancel that because we felt the issues around COVID in the community and the issues around how we're going to work with our school systems on this took precedent over spending the time on an evaluation that was not it's needed but not urgent. So there'll be no executive session in today's meeting, although that was originally part of the reason for the planning of the meeting. But we've got much more serious fish to fry today, I think, and we'll go ahead and move forward with that agenda without objection. I'm happy to have any additions to the agenda at this time or corrections to the agenda at this time if anyone wants to propose them. And if I hear none, I'll assume we have assent to from the group to proceed with our agenda. Eric, do you want to talk about our what the operations of the health department are around our current state with COVID-19 in Lucas County?
Yes, Dr. Ross, thank you very much. I wanted to start off today just operations of the department and current conditions of COVID, and that would, I think, lead us into, I think what we're here for is the school recommendations. First is just a point of information. Again, it's an operational concern, but I do want the board to know that I will start probably periodically declaring an internal emergency for operations at the department. And what is that for? That gives me a little bit greater latitude with inside of our union contracts to assign work. So really when I do that, that is just putting the union on notice that, again, I will be mandating work, whatever that is for contact tracing, follow-up, other duties. Again, that is just for FYI. I think the topic that I really want to talk about that just came up, happened a little bit last night, but more importantly, within the last 15 minutes now, got word that there could be a major festival with rides happening inside of Lucas County. Last night, there was a number of food trucks at a local business where several hundred people were gathered. We're finding that these things are starting to occur more. As we heard from Kevin Pittock a couple board meetings ago, if you would, there's two routes that we can do board orders. Of course, have special board meetings to be able to issue these board orders, or have a motion to allow the health commissioner to issue those types of board orders. And those board orders, of course, will be for mass gatherings. I'd like just a quick discussion on this issue. Again, the idea here is, I don't know how we turn around something like a festival when we learn about it to, again, issue a board order quickly without having some sort of mechanism in place where maybe I could contact Dr. Ross and Ted as the executive committee saying this is happening, we need to issue an order. I just wanted to kind of get the lay of the land with the board, their ideas, their concerns, and then possibly pursue some sort of motion to allow me to work with Kevin Pittock to create that ability for us to, out of this office, to issue that board order, again, allowing me to talk with Ted and Dr. Ross on that. Concerns, issues. Again, this is just kind of just happened like I said, the last half hour or so.
Eric, go ahead, Dr. Ross.
I was just going to say, from my perspective, I understand that there may be times where it's urgent enough, but I would say that anytime there's adequate time to consult more members of the board on this before moving ahead, that would certainly be my preference. Email works pretty quick. I know we need a quorum to make an official board decision without giving you that authority. So I think that my thought on it would be that if we do go ahead and give you that authority to move forward with conversation in the executive committee of the board, that it would be my intention, I hope it would be Ted's as well, I'll see what he thinks about this, that if we think that there's good reason to involve other board members in that decision, that we would expand that decision-making process if it's possible to do so without allowing a major danger to the public.
Right. I'm in complete agreement with that, Dr. Ross. I think, again, but I think right now, time, in this case here, time is of essence. And
Yes.
I think we need to be able to give Eric some flexibility here with respect to reacting to something like this, because I'm afraid more of these things will be popping up here as we get into the festival season. So I think we need to go ahead and try to work something out. We can allow Eric to work with Kevin Piddock and get some of these things done.
Okay. Matt, you wanted to say something?
Yeah, I just think that especially since this can be a very challenging issue, I would like it if we could just develop, and I'm not looking for anything elaborate, just a page, no more than a page, just a policy around this. These specific types of events that are over this size, that revolve around this level of contact, and then that policy would again grant the authority for the health commissioner with approval from the board's chair and vice chair to do that. I just think that providing some parameters around there not only helps the board, it also helps consistency, which I think is one of the most important things as we go through all of this, and then helps to empower the chair and the vice chair as well as the health commissioner.
So Eric, do you want to comment on that thought?
Jonathan, before Eric comments, may I just add?
Yes, please. Yeah.
I think my sense aligns with the sense of the people who have spoken so far. I very much think we should have a set of guidelines or criteria that will guide Eric in his decision. I have no problem delegating to Eric that decision. I think before he acts, he should confer with you, Jonathan, and any other members of the executive committee who are available, but should have the power to act unless you, Jonathan, as board chair, think the decision should be delegated to the full board, in which case I would ask you to convene us as promptly as possible. So the delegation would be standing, but always subject to your decision after conferring, Jonathan, that you think it should engage the full board. That seems to me a process that honors our need for rapid action, that places in the board the responsibility of articulating the criteria, and also gives you as board chair the ability to engage the full board if there's some nuance to the decision making, whether it's a policy nuance or a public perception nuance, to take it to the board. That's my sense of the proper process.
Okay, thank you. Others want to comment before I move on to Eric in response to trying to create a policy? I know we may have to act on this one without an official policy, but Eric, you should speak to the specific issues that you think should be within that policy so that we can quickly discuss them with regard to this festival before we authorize you to work with Kevin to create an order to not allow it to go forward.
My biggest points, of course, would be following the governor's directives and ODH's directives relative to mass gatherings. Again, we understand that a catered event is much different than a festival or some other mass gathering as that. So again, we would definitely follow the process and procedure set forth by ODH and the governor. And again, I have no problem with setting up a policy or a procedure, if you would, on how that is actually laid out. So again, I do believe that a lot of these will be able to be handled by the executive committee, but I also would suggest that after that decision is made, the whole board would be made aware of what is going on. So, for example, we have a discussion with the executive committee about this festival. The executive committee said, go ahead and issue the order, or it's okay to issue the order. We would go ahead and issue at the same time. Would be notifying the rest of the board that we are issuing that order. And then, of course, as you said, I think Matt said, the idea here then is if it would need additional support from the board, we could convene a special meeting and then actually issue that order at that point. So that is not a problem whatsoever.
Okay. Other comments from board members, please?
I guess I would just add, to reassure the public that when we're doing this, as we make this order, we are by nature documenting the criteria by which we are determining the need for the order. And that, like Matt was saying, can help with consistency. We want consistency across the county. We don't want to be in the business of making personal decisions. These are not personal. We have criteria and we follow the governor's orders and we follow the best science as we can. when possible. And then we document so that we can have consistency with future issues that will inevitably arise. We're only human.
Other members of the board want to weigh in on this, or are we pretty satisfied with the sense of where we're going with this?
I think
Sorry to
also-
interrupt.
Go
This
ahead.
is Kevin
Is that
Fitz. I'm
Tom?
trying to, yeah. In terms of delegating to Eric certain powers,
Kevin.
the board members who spoke up were more correct than you know. The way the law reads, the board can delegate such powers to Eric, but only pursuant to a policy. And more importantly, that policy has to be approved not only by the board, but by the DAC. So you can do it, but the board must first create a policy, and then the board must vote on the policy, and the DAC must also vote on it, and both bodies must approve it.
So Kevin, what about this particular event, which is coming up this weekend? Is that right, Eric?
I think the board would have to take some, if the board wishes to take some sort of action, it can do so. I don't know that it can delegate to Eric right now the
Okay.
power to do anything.
Right. So we would have to convene in some way in order to issue these orders each time until we have a policy that we have agreed upon and the DAC has agreed on. Is that correct?
That's correct. Sadly, that's what the law requires.
Thank you, Kevin.
Okay.
So Eric, comments with regard to that clumsiness? Don't you dare laugh.
We'll quickly get that that policy together and see what we need to do to get to the DAC. The DAC needs to meet again anyway. So this is probably it'll give us a little bit of time to actually create that policy, get it to the board next time we meet, either at a special meeting or at the next board meeting, and see how I can convene the DAC to actually look at this. Do we know where it's at?
They're gonna get the information.
So Eric, we have
Yes.
an immediate problem though,
Yes,
correct?
we do. That is correct.
So do you want to go into at least an explanation about why you think we should issue an immediate order with regard to this particular festival?
So as much as we know right now, we understand that this is going to be a festival with rides. So it's definitely going to be a mass gathering, 10 or more. Again, the issue comes back to, much like any of the other festivals have been stopped. And it really comes back down to our current condition with cases, as we'll talk about here in a second, that again, we're red, and we really should not be holding these types of mass gatherings.
And do we have a number from the governor of a mass gathering?
As we know, 10 or more, I mean, it can be 300 if it's catered. There are some nuances. Again, even the idea of, the county fairs have been stopped with other than junior fairs. So again, the grandstands and things of that nature, as well as those mass gatherings of rides and things have been curtailed.
So we could actually use the governor's current policy restricting mass gatherings as our appropriate reason for asking this festival to not go forward?
Correct.
Then I would say that's probably what we would need in a motion from the board to give you authority to compose an order restricting this festival from going forward.
Yes.
Does the board want to present a motion to that effect? And if so, let's do it, and then we can have a little more discussion and close on this issue.
Can I ask a question before we would do a motion?
Mhm.
Kevin Pittock, what power, if any, does the governor's order provide to the local health commissioner in regards to gatherings over 10 people that are obviously catered?
The board can enforce any order issued by the director of health. So that any order issued either by the director of health or by the governor, the board can enforce by motion. So you won't have a problem, I do not think. Now, I don't know, I haven't seen all of the orders issued by the Department of Health, but assuming that there's one applicable here, the board can use it as its authority for denying or prohibiting this festival.
And Kevin, does that grants the board that, is that extend in any way beyond the board to the health commissioner, or still the power rests with the board?
The power rests with the board, other than what I mentioned earlier, and the fact that the board had a policy where it delegated this authority to Eric, and that policy had been approved by the DAC.
Okay, thank you.
Other than that, it's up to the board to prohibit things.
So if things do come up in the interval, Eric, it sounds like we're probably going to need emergency meetings
Correct.
until we have that policy created and distributed to the DAC for their review and their vote. But we've got to, again, at this point, unless there's additional discussion before calling for a motion on this particular festival that's coming up this weekend, do we need to be more specific in our discussion, Kevin, to name it at this point?
I think you could limit it to any festival that violates I don't know if you, as long, that way you're not singling out this specific one, but anyone that might take place is prohibited if it violates one or more of the orders issued by the Director of Health.
Okay, so that would be a good way to create the motion then. So I'm still looking for a motion to the effect to restrict any festival or other mass gathering that violates the governor's specific orders around the size of mass gatherings, or violates other of the governor's orders with regard to the COVID epidemic.
One last question, I think, to Eric, to Kevin, and maybe Dr. Ross. When we make an order like this, because it's broad enough and general enough, do we put a time frame on it? Is this a 30-day order? Yeah, that's my main question.
Yeah, I think that's a good suggestion, Richard.
It's not a bad idea.
30-day? Okay,
That's not a problem. That's actually a good idea.
good. All right.
What I would suggest is going a little longer than 30 days. I would like to be able to allow it to cover through our upcoming meeting of the board, and then maybe one additional meeting. So what would that be? 60 days. So that would give us the opportunity to meet twice before having to, and it would give the DAC more time to respond to a policy effort. But I'm okay. We can always renew it, but then we'd have to meet again to renew it. Although we will be meeting at least once.
Correct. Do we want to say 60 days or September 24th, which is?
Does that get us through an extra meeting or not?
Yeah, that'll get us through the August meeting, and then at the September board meeting, we could revisit this.
Could we instead just link it to our level as declared through the Ohio Public Health Advisory and Alert System? So long as Lucas County would be declared a red county by the Ohio Public Health Advisory and Alert System, all festivals with a little over 10 individuals would be prohibited. Could we do it that way?
Seems reasonable to me. Eric, is that
Yes.
adequate?
Yes, that is.
And then if I would just ask that, obviously in the policy that we're going to have, that Eric, you're going to develop and bring to the board and the DAC, obviously it'll roll into this, and then this singular policy that we will pass today will again be superseded by that new policy when we pass it. So.
Question.
Yes, Donna.
In terms of the DAC, how many people does that mean? Is this their leadership? They have sometimes a problem with the quorum, so that might hold things up significantly.
Trying not to snicker here.
They'll need a quorum.
Yes.
Well, and until their timely response to us, I guess we'll just have to continue to renew and try to apply the best policy we can. And if that forces us to meet, at least we've been so far fairly successful in maintaining the ability to get a quorum together on an urgent basis.
Right.
So I would say that it's a good comment, Donna, that sometimes it takes a while for the DAC to take action. But I think that if we have to, we can have special meetings if we must to renew that policy after the 60 days.
Thank you.
until they actually come through for us. I don't think, we still don't quite have a motion. I almost heard one out of Matt. Do you want to wordsmith that for us, Matt?
Sure.
I might have it.
Oh, go ahead,
all right.
Richard. Go ahead, Richard.
All right, Matt, edit this if it needs editing. I would move that we enforce the orders from ODH and the governor's office in regards to mass gatherings over 10 people, so long as Lucas County is in this red level by the Ohio Public Advisory System. Am I missing any teeth on that?
There was an extension on that, which was that while in the interim, we develop a specific policy about how we're going to enforce the action in the future. I think that we don't have to lump them together, but I think
that maybe,
but maybe we could do a separate motion perhaps then on the second piece, which is directing Eric to create the policy. Do you think that's a little cleaner? Let's do that. So let's take a vote on this immediate issue of the festival coming up this weekend. Eric, do we need to name it so we're specific in our?
No, I think we're better doing it broadly. Do we want
Okay.
to put a time frame on this? Because that was not on the motion.
Yes, let's add that time frame of 60 days
60
without
days.
objection. I think I heard no objection.
I think the putting it to the red eliminates
Oh,
the
I'm
need
sorry.
for the time frame.
Okay. Thank you.
Other comments here from anyone on the board? Eric, do you think we should roll call this, or can we just?
Yes, we'll roll call. We'll roll call. So do we have a motion to second? I'm sorry.
Yeah, we need a second.
I second.
Okay, that was Fritz.
Okay. Roll call. Fritz Byers,
Yes.
Barb Conover, Richard Fernandez,
yes.
Helene Griffin, Matt Hireman,
Yes.
Ted Kozrowski,
Yes.
Donald Murray, Susan Postal,
Yes.
Dr. Ross,
Yes.
Barbara Sarantu,
Yes.
Michelle Schultz,
Yes.
Dr. Donna Woodson,
Yes.
Donald Murray.
Yes.
Thank you. It passes.
All right, second motion here to get Eric to develop a policy, please.
Point of clarification.
Yes.
Do we need to make a motion for this and vote, or do we need to see the policy first and then vote on it?
Well,
Or
I
are
don't
we
know if we need a
pre-voting
motion
on
to
the policy?
direct. I don't know if we can just by consensus agree that Eric's going to develop a policy that he'll bring back to us.
Can we see it at the next board meeting and then vote on it?
I don't think we need a motion to ask Eric to develop the policy. I think we've talked about what the focus of the policy should be. We have legal advice that we need to have a policy in place so that we can make an effective delegation of our authority in the contours of that policy. So if Eric has any questions about what he thinks the policy should address and how we would like it to conform with the governor's orders, he should ask them. Otherwise, I think we can just ask Eric to do this, ask him to do it as quickly as possible, and express our expectation that the policy be ready for review and comment by our next board meeting.
Okay.
Can do. Thank you. This helps us out immensely.
So shall we,
Want to move on?
yeah, let's move the agenda to more discussion of the operations of the health department with regard to COVID.
Okay, I'd like to just really dovetail into, I think, the schools. But again, I wanted to share a little bit of data of where we're at. And let me pull that up. Can everybody see the screen, please?
Not at the present time, Eric.
Oh, boy. Let me try it again. Technical difficulties, I'm sorry.
Alice is host. Does she need a, oh, there you go.
Can you see the screen now?
Yes.
Excellent. Virtual world. Okay. I want to just run quickly through some data. As you know, possibly the governor talked about this the other day. We were 183 per 100,000 rate of infection. That puts us second on a list of all 88 counties as the highest. We're still at risk level 3, which is red. A couple other things that I want to draw your attention to, current issues are our positive rate. This gets a little sticky because again, positive rates are the positive tests versus the number of tests total. So again, the negative test. What we found out with the community testing that we did the other week at UT is we got about 10% positive rate. And if you look at the hospitals, it's about 6%. Again, not quite comparing apples to apples, but again, it is a good snapshot of what's occurring in our community. If we looked at the guidance, and again, guidance is everywhere relative to the research, below 5 is really where we want to be. And a lot of the research out there is below 3, which is a very sound percentage, again, to get the virus under control. So as you see, our snapshot, we're much higher than where we probably really want to be able to really fight the virus. So just want to run through some hospital data. And I think in general, I'll just kind of mix this all together. We're doing very well in this community with our hospitals and the issue of, again, making sure that we have bed space, make sure we have vents, we have vents, make sure we have ICU beds, we have ICU beds. So again, at this point in time, we're not seeing the issues we saw early on with COVID when we started inundating the hospitals. And again, over the last 7 days, we've had no reports of death. So again, just a snapshot of what's going on in our community at this point in time. I want to bring your attention then to age distribution. And again, we've talked a little bit about this before. We are not seeing the cases in the, if you would, the elderly like we saw a few months ago. However, we are seeing cases in these, if you would, these lower age groups. Again, it goes back to kind of what we're looking at of where they're getting the virus, if you would. We've talked about bars and restaurants. We've talked about, again, traveling and congregating, those mass gatherings, backyard barbecues, things of that nature. So we started seeing this really a little bit after July 4th heavily. I want to bring your attention, though, to, I think, kind of where we're leading our discussion. If you look at Lucas County, our age population from 0 to 19, total cases by month, you see back in March, again, when we shut things down, we were 1.2%. As we went through the last couple of months up into August now, you've seen a steady increase. Again, what's going on? Well, again, we know that we could probably see some infection from, again, the family units. So again, they go travel, do those things. But we're also then seeing an increase in gatherings such as for sports and other extracurricular activity. So we are seeing this increase in the much younger population, not just that, if you would, that 21 to 40 year olds. With that said, I want you to take a look kind of too at some other hospital data just to show you that, again, in a graph form, we are pretty much, again, flatlined for ED visits, ICU beds, med-surg beds, if you would, and then vent use, which is very good. I mean, we have a goodly amount of room to spare with vent use. So the hospitals are not the issue right now. It's the issue of these mass gatherings. It's this issue of, again, what do we do because of 183 per 100,000 cases, rates of cases in our community. And this all leads back to, again, our snapshot in time of what's happening in our community. It's different than Wood County. It's different than Holmes County. It's different than, Cuyahoga County. We are different. Each one is different. So what is actually contributing to our increase? I just want to talk to you a little bit about this before we move on to the discussion with school. If you look at what happened back in middle of May, maybe even a little earlier June, we were being praised by the governor, Northwest Ohio, Lucas County, of our not, if you would, the ability for us to, again, give infections to other people. We want to be below 1, and we were. As we were being praised for that, other major communities like Cuyahoga County, Franklin County, Montgomery, Hamilton, around June 10th started to see an increase in cases. While we were very low, they were starting to see the increase. What happened about a month after them, about July 10th for us, is we started seeing a significant increase in cases. And at this point in time, we still continue to see an increase. So I don't know if we're peaked yet, but those other communities have taken a downward turn with their cases. So if we kind of extrapolate or we make an assumption, we are probably 3 to 4 weeks behind what those other communities have experienced. So I would hope in the near future, we would start seeing some sort of decline in our cases. Also then too, what plays into this, those larger communities that had massive issues several weeks ago, of course, they went to red very quickly. We were, about a week and a half, 2 weeks behind them to go red. They started using face covering sooner than we did. There was more emphasis on the issues in those communities. Those issues became our issues when we went to red. And then the mandatory mask directive came into play the other week. So again, I think there's a number of variables why we're seeing an increase in cases while some of the other communities are seeing a decrease. But I think there's some light at the end of the tunnel, which I want to make sure the board hears. We are seeing better face covering use. I was able to go out to the mall the other day, and I wanted to take a quick walk and see what was happening. And when I walked to the mall, I was going to be ecstatic if I saw 70% face covering use. There was at least 99% face coverings, 98% of them being worn properly, but pretty much everybody there was abiding by the face covering. What does that really mean for our community? That means that we are utilizing this tool that we know, we don't know how much, will decrease the infection in our community. The ability for this to spread in our community is really what we're trying to stop. And those face covering it will help. But that's just not the only thing we need to take into consideration. These mass gatherings we just talked about, they have to be curtailed. The issue of, again, going out when we don't need to. So all the things we've talked about, these are all tools that need to be used if we want to severely decrease the amount of COVID in our community so that we can go back and do things. So with that said, I just want to make sure, again, the board had the ability to understand what was happening in the community, where we were with data, and what we were looking at, again, overall in general for the community. I will add that we have been working on matrices that, again, we talked about over the last couple weeks. How do we go virtual or non-virtual? And we are working on those. We don't have a final product yet, but again, those are well on their way to again, something that can be utilized as good guidelines. So Dr. Ross, with that said, I just want to make sure the board was brought up to speed on where we were at.
See, did we drop Dr. Ross? Maybe he's reconnecting.
Yeah, I do not see Dr. Ross.
Yeah, my apologies. Can you hear me?
Yes.
We hear you.
I'm having battery issues on my phone. I might switch to my computer here in a second because it's just making me nervous. So if there was a question to me, I apologize. I missed it. So,
Dr. Ross, I just
yes.
kind of went through the data and some of the graphs.
I heard it all.
All right.
I just lost about 10 seconds there while I went over to make sure my power cord was plugged into my phone. It seems to be charging now, so I think I'll be okay. But it was just a couple of seconds where I wasn't sure if I could hear anything. So are we ready to move on and specifically talk about, given this data, what we think is the best advice that we can give our school systems?
I am ready for that if you are, Dr. Ross.
Others on the board, are we ready to move the agenda? Any objections to moving the agenda at this point? All right. So I could either kick it open, but maybe I'll give my opinion off the bat. I've already done it in writing to to a number of you, but when we're in the middle of this very dangerous pandemic and our case numbers in our community are as high as they are, all of the public health science says that if we open schools, we'll be closing them very quickly because almost without doubt, we'll see outbreaks given the number of cases in the community. I would love to be wrong. I know some schools have already opened. And so we'll see whether my predictions are true, but I think with the case numbers we're seeing, this is a really bad time to open. I really feel that the wisest idea would be to go virtual at this time. I think the other thing that I think I want to say, and I don't know if I've said it before, although the kids are important to us, we love them, they're not in danger. That's not the point. The point is that everybody who's going to be trying to take care of and teach those kids could potentially be in danger, especially if they're over the age of 40. And I hate to say it, but whether we're able to open schools safely is about what we do as adults in our community. I was glad to hear what Eric had to say about going to the mall and seeing people wearing a mask. But I've been to some other areas in town and I've not seen that. And I think that if we're going to open schools, if the adults in Lucas County want to open schools, then we need to behave as if we're on shutdown as close as we can. I know some people don't have a choice on this, in terms of what they do. But to me, I believe that this is about the adults. This is about the grown-ups. This isn't about the kids. Because if we all do exactly what we have to do to be as careful as we possibly can be as adults in Lucas County, then we will see the cases come down to the point where we can safely begin to open. Most of the experts recommend doing this gradually. That the first thing we would do is to open to the youngest children because they're the ones who benefit most from in-person school. So starting with K through 5 and see how that goes, doing all the things that the school systems have already proposed to keep the kids safe. We're masking up, we're separating, we're trying to do as much in fresh air as we can. We're bringing air into the classrooms as much as we can. Teachers wearing masks and hopefully face shields would be a wise idea too. They're not terribly expensive, or some sort of eye protection, maybe even gloves, and then move forward from there. If we're keeping the case numbers down, to opening 6 through 8. And again, if we are doing this, I would probably say that we might even want to do a hybrid schedule for either of those two areas first, just to see that we're able to handle it. And then if we can handle through 5th grade and we can handle through 8th grade, then we can talk about high school. I think the high schoolers are the most likely to be able to benefit from distance learning, from virtual learning. And we know that we've had opportunity now over the summer for the teachers to get better at it too. I understand also that that the most difficult populations, the ones who are most vulnerable to this virus, are the very ones where excluding them could do the most damage and harm. But when we're the second most active case numbers in the state of Ohio in terms of counties, this is not a time to open the schools. And so that's where I'm at. I think that we should do virtual only, give us a period of every 2 weeks to communicate back with the school boards about how we're doing keeping this pandemic under control in Lucas County. As we see things improve and we feel we can get closer to opening safely, we can start with the youngest, maybe even do a hybrid schedule with the youngest, step into a more full-time schedule with them and our 6th to 8th graders. And then finally, I think that probably high school, it could be a choice for the students. But the fewer students that we're congregating together in our high school buildings, probably the better for keeping this under control. So that's where I'm at. That would be, if I was the sole person to make this decision, I would be strongly advising the schools to be virtual only until we get the cases under control in Lucas County for the safety of the population of Lucas County as a whole. And I understand completely about the vulnerability, especially of the smallest kids, and how important it is to get them back to school if we can and when we can do it safely. Maybe one more comment on high school sports. Again, if it was solely up to me, I would flip seasons. I would put all the non-contact sports into the fall, reschedule all the contact sports to next spring. I'm hoping very, very much that maybe by that time we would have a vaccine in our possession. Don't know it for a fact, but that would probably be my decision to delay full contact sports as much as we could. I know colleges are going forward with it. We'll see how that works out. We'll have to wait and see with regard to how colleges are doing in terms of this. But I mean, we can't run away from this virus. We can't hide from it, but I think we can all do the best we can to try and do the wisest thing based on public health science. And right now for Lucas County, I think we should probably encourage our school systems to go virtual only. So that's my personal opinion. I'm open for hearing from other members of the board. I'm open from hearing from Eric as well. I know he's done some background work. He kind of created a matrix, I think. There's some good evidence and recommendations from experts around the country that would suggest that we not open. Actually, some of them would even suggest that we are active enough as a county that we ought to go back on shutdown.
Dr. Ross?
Yes, Donna.
I know we've discussed this before, and I know that you had meant to mention it in our meeting last week. And that has to do with some circumstances in which there might be flexibility. And I want the public to recognize that we really realize not only the morbidity and mortality to our children, it is less than others, but there are the special needs children and at-risk children. And I know that you're concerned about that, and I'm sure other board members are. Some schools have made some very careful plans to address these children, and I hope that we can look at this not to say, oh, they can go back, but the others can't, but to see how things are going, and they may be a first group. And you've said this before.
Yes.
Get back in, because some schools have made amazing job of getting things ready for them. They have transportation, some school systems, will provide them with meals, transportation home. So if we'll have the flexibility to look at that and not to make it so very confusing in a hybrid way, but those children, and I know to you, some community members and superintendents and all have suggested that also.
Yeah, I'm sorry, Donna, you're absolutely correct. When I said K through 5, I should have also included special needs because, again, the impact on them is much greater than it would be for high school students who probably can function pretty well in a virtual environment. So yes, absolutely. I would say that as early as possible, when our numbers are better, we should certainly be allowing the special needs kids to get back into in-person classes as well, and to the schools where a lot of services that assist them are actually located.
Thank you.
Jonathan, this is Fritz.
Yes.
I think it's great for the board to have this discussion, but I would ask that before the board members weigh in, we hear from our health commissioner and have him provide us information. I know he's looked carefully at this issue. He's had numerous conversations with many of the affected constituencies. And I, at least, especially since I am not an MD, would very much like to have Eric's perspective on this. I know he has been avidly and with great concentration in interacting with a wide number of people in our community. That's his job. And I would ask that he give us his thoughts so that will form the grist for our discussion as board members.
Excellent suggestion. I didn't mean to jump it. I really meant to kick the conversation off. But yes, let's hear from Eric. Thank you.
Thank you, Fritz, and the rest of the board. I really appreciate your support in this very difficult time of COVID-19, but specifically now, this is a major issue and a major recommendation. I will stress that I do believe that we should recommend. We do have the ability to order schools closed, suspended, but I believe that this really should be a recommendation. And if we want to parse words, highly recommend of what I think should be done, which is to actually go virtual in a virtual format with a projected return of October 1st of 2020. That is a movable date, I do believe. Again, if we see that cases, if the community is doing well, cases are beginning to really drop off the second week of September. Again, we could come back and recommend, yeah, why don't we start going, like you said, Dr. Ross, maybe go back and look at K through 5, those special needs groups, and say, yeah, I think it's time to be able to get back in. But I do believe that at this point in time, with the amount of virus in the community, the issues that we do have with, again, testing, with the issues we have with mass gatherings, and again, contact tracing, and the lag of testing to get to those contact tracers, or the contact tracing, it's going to be very difficult for us to be able to, again, if school does start, to get in there and really piece out the issues of COVID in each one of the school buildings that eventually will have issues with either disease for isolation or disease for quarantine. So again, that is a true concern. I would hate to start school and then within 4 weeks have to again start looking at forcing schools to go virtual in a very quick manner. So again, that would be my recommendation. I also would like to maybe chime in on a little bit of the sports. And again, this is always very difficult as well. But again, probably the recommendation should be to hold off all sports until the same time frame. But there is also the ability to recommend that at least all high-risk sports delay competitive play until at least the same time frame of 10/1. So again, that is something that I would like to again present to the board as a recommendation. Again, we talked about special needs. I would like to possibly also to recommend any in-person orientation and or special needs issues, special need children issues, actually take place in the first week to 2 after school starts, so that individuals can go in, actually have that orientation, but they know that they would have to go then be pulled back out and go virtual. So again, that orientation needs to happen pretty quick. And then last but not least, and I think this is this is probably preaching to the choir here to the board, but just to make sure that all mask and face covering, social distancing, and hygiene use to combat COVID-19 must be followed. So whether that's during orientation, if teachers are going to be in the schools and they're teaching virtually, again, all those things need to be followed, and that's just another stressor. So again, Dr. Ross, those were my thoughts. Those are, again, the thoughts, I think, of my staff as well, too, as we've had those discussions. And this is not an easy recommendation, but I do believe that is one that is best for the community and best for our students and schools at this point in time. Again, if we had less disease in the community, this decision probably would not have to be made as such. I will like to add that Erie County, their health departments last night did vote to recommend virtual to start off as well too. And there's been several other major counties that have done the same thing as we talked about last week. So again, as we move closer to school, other counties are looking at the same issue and deciding to go virtual or not, or at least recommend to go virtual or not. So Dr. Ross, those were my comments for the board to chew over and to maybe guide discussion.
I don't know if we want to discuss the public health science upon which this is based, but I'm happy to open that up to if others want to ask questions about this. I've got some additional numbers in front of me I can talk with you about. But
Dr. Ross?
Yes.
I would, if it's okay, like to back up just a moment and frame everything that we're talking about, because it is under the umbrella of what Eric is really feeding us here as far as data and good public health. In reviewing, especially, let's say, the American Academy of Pediatrics statement on return to schools, I want the public to know that the board and the department is starting from that place of consideration for the school year of having the goal of getting students face-to-face in school. Like, we want that. And from there, we go on to figure out how do we do that safely, both for the students, the teachers, the families, and then, wow, we're looking at the whole community. And it's not just an afterthought, but that's where the discussion starts. And that's where all of our superintendents have started from. And they've brought that discussion to Eric, and Eric contributes back to them for the past several months. And unless anyone disagrees on the board, I think that we have considered these documents from the CDC, from the American Academy for Pediatrics, as well as other national authorities on getting back to schools. Like, we do want that. Am I right?
Absolutely correct. I mean, I agree with, that's excellent that you made that point, that it is certainly the goal of the Board of Health to get students back in the classroom. But we need to do it safely without compromising the health of the students or the staff and faculty of the schools or the community as a whole. So that's the balancing act, and it's a tough one.
So Mike, can I ask Eric a question that maybe the rest of the board could chime in on if they feel able? If we went back face to face, right? I want to start from this, if we all go back face to face, if we did this and our positivity rates stayed above this 5% threshold, what does that do? What's the curve of increase, what's our prognosis for the community? Because my understanding is it's not a linear curve. We go from 5 to 6% to 7%. My understanding is that it becomes a little more geometric, exponential, and that's why we have thresholds, even though it looks small to some right now.
Yeah, Dr. Fernandez, thank you. Again, you're 100% right. As we know about the disease, it is more of an exponential type of infection. And that's why when we had our R naught of under 1, we were being praised, because again, that infection was slowing to a degree where we weren't infecting other individuals. So again, as we get more disease in the community, it infects other individuals exponentially, so that 1 now is 1.2, 1.52. So again, that's the issue. Let me give you just, and I've used this a couple times, and I think it works out really well. So if we had the ability to take, depending on your age, 10 tacks or 10 jacks for some of us who are older, or 10 Legos, and throw them on our kitchen floor and try to walk across it, we're probably not going to step on anything. So again, those tacks, jacks, or Legos is the disease, or the ability to, again, become infected, if you would. You take 183 of those, like we have right now, if you would, tacks, jacks, or Legos, throw those on your kitchen floor, then try to step across that floor. You're probably not going to get across it without stepping on a tack, a jack, or a Lego. And then if you would, if you step on one of them, they split apart and they could infect other individuals as well too. So again, it is that idea of the amount of virus in our community, which I think drives any recommendation at this point in time, because of that example of the kitchen floor 10 versus 183, or you can use any number, 20 or 50. Again, as we go down in this rate, if you would, the better off we are, so we don't have that virus infecting other individuals or reducing the liability and or risk inside of a school or business or wherever it might be. That is why it's so important for us, again, to do all those things we've talked about. Wearing the face covering, hand washing, don't go to parties, stay home when you can. And I know that I keep on repeating that, but we all need to hear that multiple times because it needs to sink in. So again, Dr. Fernandez, I hope that answered your question.
It did. I knew you'd be able to illustrate it well for us. I think the visual was helpful. Thank you.
Just let's be really explicit. Our numbers are 83 per 100,000. Is that right, Eric? Is that the actual number?
It's actually right now from the EPIs down at ODH. It's 183 per 100,000.
Okay, 183.
83. Yes.
Okay, so that's from what I'm seeing, about 7 times what the experts are saying is the level at which we would feel comfortable letting kids go back, even on a modified schedule, on a hybrid sort of schedule. So we've got a lot of work in this county to get our cases under control. And maybe you should talk a little more about how we might be able to accomplish that, Eric. I don't know, that might be helpful for the school board too,
Yes.
to hear the effort that's going on to try and throw a rope around this. But remembering again, as I said earlier, this is all about the grownups. This is about what we do also as individuals to prevent the spread, regardless of what the governor's orders are. We have a problem in Lucas County, and we need to step up as the grownups in Lucas County and help get this awful disease under control within our own county.
Dr. Ross, yeah, Dr. Ross, thank you. Let me start off by saying, again, we are all well read. I think on the board, I think our community is very well read. They do research. I've got a number of different emails. I really want to talk just real quick about CDC recommendation. If we look at the CDC recommendation for going back to school, they say as long as you have low numbers in your community, you can go back to school. They also say that if you have higher numbers and you go back to school, you could add to your issues inside of your community. So again, what is low? Low is not 183 per 100,000. Again, there is some research out there that said, if you would 20 per 500,000 is a good number to be able to get back to doing the things we want to do. And again, I don't want to spend a ton of time here, divvying out the research, but we are not at that level where CDC says, I do believe to go back to school when you're not going to really have issues. We are going to have to deal with COVID for a number of more months, and it could be another year or more, depending on vaccines and things of that nature. We're going to have to live with it. And it goes back to your point, Dr. Ross, is that it is, again, up to us. I think the governor said it. We've said it a number of times. It is up to us as adults. What do we want our next couple months to look like, or our next couple years, if you would, to look like? How are we actually going to get to that point? And again, it is a little bit about the kids, but the kids in our community are, they're the ones who are at the football practice. They're the ones who are going to school, of course. They are living their life as they know it. It is up to us as parents to make sure that, again, this is why, Megan, you have to wear your face covering. This is why you can't go out on a Friday night. This is why, if you're at a extracurricular activity, you go, when you're not doing it, you're 6 foot away. So again, we could teach the kids that. It's us as adults that, again, we show them as kids what should be done and what shouldn't be done. If we're saying, hey, let's go out to the restaurant and it's packed and we go inside and we're still sitting there trying to eat, again, that's not going to help our cause. If we're not wearing face coverings as we're walking around next to each other, that too is not going to do it. So again, we lead by example. And I think some of the other concerns too that we're seeing in our community is, again, if you're sick, you need to understand to stay at home. Same way with the kids. If you're sick, you're going to have to stay at home. Again, these are all things that we as adults have to pass on and show our kids what is right and what is wrong relative to COVID-19. I do believe in I gave some light at the end of the tunnel, and I think that is so important. This is not all doom and gloom, but it's going to be upon ourselves as individuals to do the right thing to make sure that we stop the spread as much as we possibly can. And again, it goes back to the things we just said and we just talked about. I do believe too that research is really important. And when we say that face coverings are the most useful thing, it's very hard when we have individuals in our community saying, no, it's not. I'll not wear my face covering. And that really does hurt us, because that plays into these numbers, these increase in numbers. And this is nothing that we haven't said before, but again, it's important for us to understand these are the things that are going to get us out of this current predicament of such a high infection rate.
Do other board members want to respond or ask questions of Eric?
Jonathan, this is Fritz. May I comment briefly on this?
Yes, please.
I think the comments that have been made so far reflect how seriously the members of the board have taken this issue Eric is correct. I know to a certainty that all of the board members have spent hours trying to educate themselves about the factors that weigh on this decision. I know I have, and I know everybody I've spoken to has reached out to as many people as possible in the education community and in the medical community and in the public health community. And this is a very serious decision we're making now. And I can say to a certainty that all of us on this call have thought deeply about it and worked as hard as we can to gather the relevant information. The Ohio Department of Education and local boards of education in Ohio are responsible for making the best decisions they can make in furtherance of the missions that they serve and the responsibilities that are assigned to them under state law, as well as the historical precepts of our government, which in many respects make education a highly localized function of government. In certain circumstances, the decisions of local boards of education can be overridden by other local governmental actors, by state actors, or in extraordinary circumstances, by federal actors. But in the absence of overriding decisions of that kind, I know from my experience with boards of education that they make the decisions they can based on the best information they have, as fully informed as they can be, and on as logical a basis as possible. Likewise, the Ohio Department of Health and local boards of health are charged with making the best decisions that we can make in furtherance of the missions that we serve. Our mission, as stated in our mission statement, is that we are committed to being the leader in public health by promoting and protecting the health of all people where they live, learn, work, and play. And in furtherance of that mission, we've identified core values of health promotion, focus on people, collaboration, communication, empowerment, and disease prevention. From a public health perspective, and from the perspective of serving the mission of the Toledo-Lucas County Board of Health, the decision we make regarding opening of schools must be driven by health science, the best information we can gather about public health and the effects of individual decisions and collective decisions on the health of all people in our community where they live, learn, work, and play. And we have to make decisions the best we can based on science and information that fall within our purview. There are a range of decisions that our board could make. We have, in certain circumstances, the ability to issue orders. And in other circumstances, we can take a step back from that and provide guidance and recommendations from a health perspective that we would then in turn expect educators and other people who interact with students, teachers, and staff at schools to implement those recommendations and guidelines as best they can. Based on everything that I've heard in this meeting, everything I've heard from Eric in numerous discussions I've had with him, and everything I've read from educators and health scientists, I think our best function now, consistent with our mission, is to make recommendations supported by science and identifiable metrics that will help educators in turn make the best decisions they can make in the hope that we can control the public health crisis we're facing. I think the recommendation should be remote learning for a period of time to see if we can bring the rate of incidence of infection down so that it is manageable. All of us want our community to return as quickly as possible to normal functioning across a whole range of functions that we as humans undertake. And certainly educating our young people is at the very forefront of our most important civic responsibilities. But from a Department of Health perspective, taking into account what our mission is, I am convinced that the best thing that we can do for our entire community, from our oldest citizens through the people who work in our schools and through all of the students who would attend those schools, is to put a pause on the return to school, the physical return to school, and pursue, and we should issue a recommendation for remote learning to be periodically revisited and have its efficacy measured against all of the objective criteria and metrics we can establish to continue to, consistent with our values, collaborate and communicate with all of the decision makers in our community so we can collectively move together for the best decision for our community. We should not allow the schisms that are infecting this decision for extrinsic reasons that are extrinsic both to health and education, to continue to separate us in our community. We should pursue our values of collaboration and communication, because I believe when we look at the right criteria, isolated from prejudices or presumptions or extrinsic criteria, I think the science will lead us to the right decision. But I believe that the science tells us now that the right decision is to engage in remote learning. And I think our recommendation should be to that effect, with a revisiting of that decision on or about October 1st.
Dr. Ross, you're on mute.
Yeah, I just want to say thanks, Fritz. That was eloquent, and thank you for returning us to our mission and to our values, because I think that's where we've been coming from, but it's always good to restate those and to make sure that the community understands, that is the perspective from which we are trying to operate. So other board members care to make a comment? Eric, do we actually need to make a motion and follow up on that recommendation once we finish discussing?
Yes, I do believe we should have a motion for whatever recommendation that the board so desires to put forth.
Okay.
I would also like an idea of how the board feels about athletics and where we should recommend that as well too, because that is a very large portion of concerns in the community, because we should understand that, and again, I think we know this, and I had to be reminded the other day, sports and extracurricular activities, if you would, are an extension of the classroom. And they are important. They serve a purpose for the growth of every individual who takes part in those activities. And there's guidelines that are being set forth by the state for competition and or practices and things of that nature. So I think we do need to also visit that as well, Dr. Ross.
All right. And I think I did weigh in on that. What my thoughts were, that I certainly didn't feel that high-risk sports, contact-based sports made sense at this time. Given we don't even want the kids in class together, how can we let them pile up on each other, in contact sports? If there was some way to flip, but there's so many other agencies that have a say-so in how high school sports schedules work. So I can't presume to speak to that, but I would certainly think, as much as possible, trying to flip schedules is something that would make sense. But again, this is something that isn't within our purview, but I certainly would say that, contact sports, they're even worse than letting the kids into the classroom. If we're not recommending the kids go back to the classroom, how are we going to let them 22 kids pile on top of each other on a football field? That makes no sense whatsoever. So additional comments from the board members?
Sure. Can I just add something, Dr. Ross?
Yeah.
Obviously, I can't say any better than Fritz did and the other board members did. Our position on this, I concur with everything that was said, particularly by Mr. Byers. The only thing I would want to build upon is the importance of what Fritz touched on at the end, which is collaboration. And I think that Eric has done, I've talked to a number of school officials over the last week, and I've heard nothing but compliments of Eric and his level of collaboration in the last couple of weeks with them in talking through this. And I would just ask that collaboration continue and maybe even expand, particularly if we're going to go remote. How we come back, I think, and you've probably heard me say this in previous board meetings and probably in every board meeting, it's one of my kind of like tenets because I'm a nerdy administrator. But it's all about consistency. And I think the greater amount of consistency we can have in the community, whether we're talking about the way we go back to school or the way in which we would ask sports to occur in this community moving forward, is critical. So I am a firm believer, especially, and I will tell you that in talking and observing many of our superintendents, and I'm not a person who just like doles out random compliments. I will tell you that I think that we have a tremendous group of superintendents in this community. They seem incredibly collaborative in every conversation I've had with them. So I'm highly confident that if, particularly in this opportunity, I know they have other priorities, even trying to go remote creates lots of challenges and they have to spend a lot of time on that. But particularly between now and our target date of October 1st to try and come back. And again, building on what Richard said, I think every single member of this board understands that it is best for our community, is best for students, is best for everyone for them to get back in person. So we're trying to build towards that. So I would just ask that we double down on the collaboration between the health department and our superintendents to make sure that we can get back in person as safely and as quickly as possible. And I think that's highly possible with everyone working together, because I think when you read many of these things, particularly from Harvard, and Dr. Fernandez has kind of provided me some of this background. I mean, this really is a decision that combines, and Fritz touched on this, public health and education. That's what makes this a complicated decision, right? So we need to make sure that conversation continues and that we make the best decision for both sides of that, understanding that both feed and serve each other. So I really would ask that we do that. As it pertains, I just have two questions for the commissioner, and they pertain to the target date, and it really pertains more to metrics, and it pertains to sports. So I'll start with sports first, which has to do with, again, consistency. In a recommendation that we would be putting out, and maybe you want to build this into the policy that you'd be developing about mass gatherings that we just discussed earlier in the meeting. But I would just say that we need to try and treat sports equally, whether they are school or non-school sponsored. And I think that's again goes to consistency, because again, if we have sanctioned school sports over here saying, well, we're going to wait till October 1st, but then every club sport, and any of us that have children now don't know that club sports are in some ways the bigger driver of sporting activity than even high school sports or grade school sports anymore. So we want to make sure we have consistency. So I would ask Eric if you have any thoughts about that, the relationship not only of school sports, but other sanctioned sports related to that. And then my second question has to do with the metrics. I'm very interested not only in the collaboration, but in the metrics being clearly transparent to everyone so that we know how we can get back and when those metrics support, so we combine that good plan that's in partnership with the schools. I know they've worked and you've worked very hard with them already, combined with the metrics and the lower spread that we need to get back so that we can have some anticipation and our parents can be informed, employers can be informed, students can be informed. So I'm interested in what the metrics are that would get us back by the target date, before or after, and what you think about the interaction between sports that are both school sponsored and non-school sponsored.
Let me start with the matrices first. As you know, we've been working on the matrices for a while now. We actually convened a meeting the other day with two superintendents, Dr. Rega, our medical director, Dr. Cadigan, Greg Loker, myself, our epidemiologist, and then Dave. And we sat down and we put down on paper ideas about how to go virtual, what does it mean to go non-virtual. And the idea there was to, again, if we needed to start school off quickly or on time, if you would, in person, how does that look to actually close, or what makes you go virtual because you have COVID in the actual school? We also are working on what are the matrices to actually, again, go back to school, so stop virtual. And we're not quite there yet. I think we need one more meeting before I actually fully present that to the board. I will do that before we actually convene for the next board meeting. I do believe I'll probably have that midweek next week after our next meeting. But again, you can imagine that some of these are 14-day rates. Some of the things you've seen in the literature, some of the things we've taken from other schools from other states and what they think would be our good matrices. So we've tried to combine local as well as national ideas into the matrices that would be appropriate for us. So again, we will have those, and all schools and parents will know kind of what that looks like. Let me talk to you a little bit about the other sports, like rec leagues and things of that nature. I do believe that the recommendation should be the same for those rec leagues. I know my daughter plays soccer, and our just last night, our season was canceled for her, if you would, for competitive play. So again, I do believe that they should fall in line. It would be a recommendation, same way we would do for the schools. And I would hope that those entities that are driving those, if you would, non-school athletics would think about the consequences of doing those sports while we're in this time of high COVID infection rates, and trying to get to the point where we can actually go back and have those sports played the way they should be played, instead of non-competitive type of atmosphere where I know a lot of rec leagues are looking at just having inter squad workings and practices and things of that nature, and that's not a lot of fun for the kids. So again, I don't know how we police those rec leagues, but again, I just think it's another strong recommendation for those rec leagues to follow suit of what the schools are doing.
All right. Other members of the board want to chime in here on either school opening or the participation in sports for those schools, as well as was mentioned, maybe making a recommendation to the recreational leagues, be very similar sort of cautionary tale.
Dr. Ross, I'd like to add just a few comments here. First of all, I want to commend the board members who have spoken up already. I mean, you've eloquently and brilliantly stated our mission, our goals, and I'm pleased to see this. But I'm going to bring this down a little bit more of a personal level. We talked about the sports, for example. I've had some conversations. I had a nice conversation with our superintendent. And one of the things he expressed to me and really got my attention was when he mentioned to me that already he had a number of young people who had tested positive, a significant number, along with even a bigger number of people who are now being quarantined because of this. And this is all before even the practices were beginning. So that being said, that should raise a red flag for each and every one of us to realize that these contact sports are certainly going to be a breeding ground to spread this COVID. And unfortunately, the young people who just don't recognize the fact that they're really risking not only themselves, but they're spreading this so rapidly among others. And one person can infect easily 10 or 20 more people in a situation like this with the sports. So that needs to be addressed. The second thing is, I had a conversation with a couple of our three different school teachers from 3 different districts. And one of the things I was asking, and each and every one of them mentioned the same thing. Their concern, of course, was not only for the health of the children and so on, but they're being asked to not only try to educate these children and to work along all these special rules and all these special procedures put in place, but they're also being asked to police the social distancing, the wearing of masks, and everything else along the way here with young people. And as you know, that's not going to be an easy task, along with everything else to be asked to do. So that burden on them is, I think, unfair. We're asking an awful lot from them. So the last thing I want to mention is just the fact that I'm glad to see we're going the course of recommendation versus trying to put the hammer down saying we must do this. I mean, there are certain instances, for example, the Ottawa Hills, they want their board wants to go along with the schooling, and St. John's went along with schooling, and I'm in a position to tell them they can't do that right now. But I think it's going to be a good opportunity for us to monitor very carefully what happens and see just exactly where we go with all this. That's all I need to say at this point. Thank you.
Thank you, Ted. Additional members of the board?
I have a question that I know Eric has answered in the past, but would be good to bring forward now. More about the bigger picture on schools. How have we assessed and communicated with our superintendents about our capacity to go virtual well? We don't just want to do it, but we want to do it well. And we want to take care of the families and children who will be most adversely affected by a virtual school program for any period of time. I know, Eric, you can speak to that.
Dr. Fernandez, just to let you know that we've had discussions with the superintendents and understand that we may have to go virtual. Again, this was early on in the planning with the understanding that, again, it could happen. So it's not a total surprise to any superintendents, but also then we worked through a lot of the bugs, I do believe, in the spring about issues that come about with virtual learning. Let's face it, that there is no replacement for face-to-face learning, and there's always going to be gaps in internet capabilities. There's going to be gaps in the ability for kids to actually pick up through that internet type of learning. I know my daughter was very lucky; she was pretty good at it. But I know some of our friends' kids, they were not very good at it. So again, there are inherent issues in that. I think one of the main concerns too is just this internet capability. I think a lot of schools have talked about now they're going to be looking at giving out Chromebooks or things of that nature. So I do believe that there's some resources there. I know that there's been some maybe gaps in internet coverage, and I do believe there's some hotspots and some other services out there that have grown from the spring to now. Again, with that understanding, excuse me. I'm not saying that every gap is filled by any sense of the word, but I do believe that we're much better off today than we were in the spring to be able to move to a virtual platform if they need to.
And then the flip side of that, Eric, how have we assessed and monitored, and how will we ongoingly communicate with, as Matt was saying, our school's ability to go face-to-face well and do it well for public health, as is our mission?
I guess every disaster has some sort of silver lining. You learn things from a disaster, and that's, I think, what COVID has done with us and the school systems. Public school systems have been fantastic, as well as the private schools too. And there is a relationship that has been built that, again, surpasses whatever I thought could have happened with us. There is weekly, if not more, communication between the superintendents and the health departments, with the understanding that there is a large mutual respect of what they need to do as well as what we need to do. And there is discussion. That there is not, again, from my chair, we've never told them what to do. We said, okay, this is what you need to do. What do you think? How do we get there? It's very collaborative. I think out of the 29 years that I've been doing public health, this is the best relationship that I think I've ever had with any one group. And I've had very good relationships with other groups. They get it, and we talk, and we discuss, and we get to a point where this is what we need to do. So that collaboration, that discussion, when we look to go back, it's not going to be back, well, we can't go back because this isn't met. It's going to be a discussion. This is what we're seeing. This is what we believe is happening. This is where I think we're going to go. What do we need to do? I believe, at least from my point of view, that October 1 date, if you would, I believe it's movable. But we pivot quickly. Well, it's kind of funny. We don't pivot quickly, but we pivot quickly more than the school systems can. And if I could say, hey, listen, things look great come September 20th. Can we get back to school, September 21st? I think that's going to be hard. But I think we need to have those conversations early on, what's going on trending wise, to get them the best information so they can open up as quick as they can. And that's my promise to those school systems and to our parents, that we are not going to drag our feet. We're going to have those conversations, and we're going to get kids back in the classroom as soon as we can.
Thanks, Eric. I appreciate that.
Jonathan, this is
Yes,
Fritz.
sir.
I'd like to make a motion, please.
Please go ahead.
I move that the Board of Health, based on public health principles and the best public health information and analysis available to us, and consistent with our mission to promote and protect the health of all people who live, learn, work, and play in Lucas County, issue a recommendation to all boards of education and school boards in Lucas County that they implement remote education for their students beginning on the first day of the fall semester, to be presumptively in place till October 1, and to be reconsidered collaboratively in light of data and public health information, which will be evaluated against criteria to be established by the Board of Health. And that further, we recommend that all interscholastic sports be presumptively suspended until October 1, likewise to be reconsidered collaboratively in light of data and public health to be evaluated against criteria established by the Board of Health.
Do I have a second for that motion?
Second, Matt Hireman.
Second.
Got a third. Good. Is there further discussion at this point?
I would just emphasize, as I did before, and as several of us have, that our best approach here as a community is through collaboration, our furtherance of our mission, our dedicated educators' furtherance of their mission, and the melding those missions in an ideal world, which we should strive to achieve, are blended and mutually supportive. And I think our issuance of criteria, and as Matt said, Eric's continuing engagement and the continuing engagement of all of the board members in active ongoing discussion in furtherance of our mission, collaborating with educators in furtherance of their mission, will get us to the right results. So I want to emphasize how instrumental and central to this action continued communication and collaboration is, and how well it will serve our community.
Thank you, Fritz. Additional discussion before we take a vote? I assume it'll be roll call.
Yes, Doctor.
All right, so hearing no further discussion on this issue, we have a motion on the floor recommending that schools go virtual and that sports be shut down until October 1st. That's a summary of it. It was said much more eloquently from Fritz, but basically we'll go virtual in the schools and we won't do our fall sports schedule, and we will target October 1st as a possible date for resuming, more direct education, in-person education. So let's hear the roll call.
Fritz Byers,
Yes.
Barb Conover, Richard Fernandez,
Yes.
Perlene Griffin, Matt Hireman,
Yes.
Ted Kozrowski. Ted. Donald Murray,
Yes.
Susan Postal,
Yes.
Dr. Ross,
Yes.
Barbara Sarantu. Barbara Sarantu. Michelle Schultz,
Yes.
Dr. Donna Woodson,
Yes.
Donald Murray, are you still on?
Yes. I'm probably
Uh,
unmuted.
Yeah, are you a yes as well, Don?
Yes.
Sorry. Did we get everybody? I'm sorry, Ted. I'm sorry. did I
Yeah,
miss
I'm
you?
sorry, I was on mute. I apologize. Yes, my vote is
All
yes.
right. 1, 2, 3, 4, 5, 6, 7, 8, 9. That is 9. That is 9 yeses. It passes for the recommendation.
Eric, let me ask you one other question. And I know at this point, it doesn't make a lot of sense because our incidence is quite high, but some people are talking about being able to do testing by pooling the tests. And I understand that always works best when it's a lower number, but it might be a way of hotspotting individual schools to look more carefully, especially given we know there's a lot of asymptomatic disease out there. I know right now it makes no sense because we're running 11% on a community sample, and almost every pooled sample is likely to come back as a positive, with that kind of a number. But as our numbers come down, maybe that's another tool that would be in our toolbox to be talking with individual schools about trying to do pooled sampling in those schools, to maybe be more aggressive even on a school by school basis.
Yeah, Doctor, yes, I do believe that is a good technique to use when we do come down with the incidents. But also then too, I know you and I briefly discussed rapid test.
Right.
And I know the governor has been talking about that and attempting to, I think, get a 6-state pact together for purchasing power. So again, I think rapid test will really help our community out. So the faster we can get those in, the better off we are. I will let you know too, with rapid testing, there is internal discussion as well with our epidemiologist and our crew here to start talking about that and figuring out a process and or an idea of how to actually go about utilizing those if we do get them in. So more to come on that.
One other point that I think for the people who are non-board members who maybe are listening and participating, that's worth bringing up. We have talked some about the ability to protect certain high-risk individuals as well, and we don't know where that science is going to come down, but there is rapid progress being made on monoclonal antibodies that may be protective, and it may be that we can begin to help control some of the incidents in the community by using those in high-risk people. I don't think it's going to happen before October 1st, but that's an additional source of relatively light, positivity. I want to just mention some positive things as well, because that may help us to give some control to our high-risk individuals, to allow them some reassurance and protection. So we'll have to wait and see where that comes down. But these are well-established medical techniques of treating other diseases, and monoclonal antibodies to offer protection against COVID are rapidly moving forward. And given this is well-established, relatively low side effect stuff, it may be something that would be one more arrow in our quiver somewhere between now and a couple of months from now. It's hard to know, but I know that's moving very fast. The other thing we don't know is what the cost of it's going to be, and that's an issue. It would the rapid tests are supposed to be relatively inexpensive, and again, being able to test. And I guess from that perspective, maybe we should also comment on how quickly we're trying to ramp up on contact tracing, because that's going to be key to controlling this thing. And I know we've already got plans to bring on board at least 8, if not more. I think, Dr. Woodson, you mentioned to me even there were some medical students who were trying to get ramped up and trained on this. So maybe, Eric, you can talk about what our goal is for contact tracers, because I think it's ambitious, but probably appropriate if we really want to get things under control.
You knew that you do know that UT is still having students work with us. We'll be getting a new batch of students in here soon for our contact tracers. We have internal staff that have been working extremely hard over the last couple of weeks with the increase in numbers. And then, of course, we have the MRC. But more importantly, I think what we're doing right now is attempting to bring in probably anywhere between 20 to 60 individuals, again, depending on how this all pans out, to be able to do contact tracing. Again, that contact tracing is so important, and the faster that we can turn that around, the better off the community is. So my goal is, they usually say between 24 and 48 hours. If you can turn around something along those lines, you're doing very well. I really would like to see us turn that around within 12 hours. Again, that gives us additional day to get out to make sure that we can start controlling the disease. I know it's very ambitious. I think we can do it. But then also too, this goes back to kind of what Matt was talking about, I think Dr. Fernandez too, and then some side conversations. What I'd like to do is, again, with these contact tracers, actually assign one contact tracer per, if you would, either per school system If it's a large school system, maybe multiple contact tracers. Again, we're going to figure that out so that they are actually assigned those schools. And when something happens, we can immediately get in there and take hold of that issue and then hopefully alleviate additional infections in that community or in that school system. Which again, it means that we don't have, we limit our liability and our risk inside that school to be able then to have to shut it down once we're open. So again, I think, again, that going virtual gives us a little bit more time to ramp this up and to get this all organized because it is a system. I think what we learned through COVID-19, you set a system up and it gets very stressed and you see the breaks and they do break. They break quickly. And so you're always trying to patch them. So if we can get a system up and running, we know that it's going to break some point, but the more that we can actually pre-plan, look at the bugs and work them out, when we do go back to school, face-to-face, we're going to have this resource that we can throw at that issue, so we don't compound the issues in those school systems and in the community. I'm excited about that. We also asked Ohio Department of Health to give us a hand, again with the understanding that we're probably going to gear up again here soon to do another community test site, probably mid-September. So we want to make sure that we get them on, we get them trained as well too, because they need training from how we do our system. And so that we're geared up, we're going to have, again, that 12-hour time frame. I'd like to even get that down lower than that, but that 12-hour time frame, I really want to hit. If we can do that, this community is going to be better off. And so that's kind of where we're at right now, Dr. Ross.
So from what I'm hearing, you're saying the quicker we can do the contact tracing and get people who might have been exposed isolated, the
Yes.
quicker we're going to get our numbers down, the sooner our students will be able to go back to school.
Yeah,
And
yeah.
that system needs to be there when we do go back to school in case there are outbreaks, that we can have that really ramped up so that we can very quickly work on that contact tracing to keep it from spreading further in the school and maybe even further into the community. So key piece of what we have to do.
Yeah. Again, that 12-hour, if we can get that even closer to 10, which I think it would be astronomical to do, but if we can get it down lower than 12, we are going to knock the socks off COVID-19 and the ability for it to spread in our community. So.
One of our most powerful, important tools. Thank you. I'm sorry, someone else spoke up. I apologize.
Actually, Dr. Ross, I got a question. The door opened here. Just want to revisit the motion real quick, if you don't mind. I do apologize. Our motion says sports. That includes contact and non-contact sports. Is that correct?
If we're not allowing our students to gather, I mean, there's some sports. I mean, I think we potentially could be flexible, but for right now, I think we should not be, just from a consistency perspective.
Thank you.
So that would be my personal thought on that. But
yeah.
Again, recognizing that there are some non-contact sports that, like tennis or golf. I mean, you can do your social distancing pretty well with those particular types of sports. Others, almost impossible. Yeah. So I think that if the school boards come back to us and ask us about certain sports, we could try to deal with those individually, I think. But for now, I would say the safest thing would be for us to at least plan to not have those sports and to encourage them to bring forward those that they think they could go forward with in a safe way and then revisit it. And we still have another meeting at the end of this month to go back at it. So I would encourage you to collaborate with them, but I think our recommendation would include all fall sports at this particular point.
Eric, this is Fritz, yes. Just in furtherance of that, I believe the wording of the motion, and in any event, my intention in making it was to apply the suspension across the board to all sports, but it was subject to the explicit statement that it would be collaboratively reviewed in light of data and other public health considerations with us. So as Jonathan said, if there were decision makers who strongly felt because of the particular dynamics of an individual sport and the public health data and analysis applicable to that sport could be conducted safely. That's certainly within the spirit of, and I think it's also within the explicit language of the resolution.
Thank you, Fritz.
Thank you.
Are we ready for a vote?
We vote on that. I think that should be taken care of business because we did the roll call on the recommendation.
Yes, we did. You're correct.
I think it's Don Murray's turn if I'm not mistaken.
Yes, Donald. Rescue us, man.
Am I on?
You are on,
Yes.
sir.
Okay. I respectfully request a motion to adjourn.
We have a second.
Second.
All in favor?
Aye.
Aye.
Thank you, everybody.
Thank
Any
you.
opposed?
Thank you.
We're adjourned. Thank you. Thank you, everyone. You really did a great job expressing, I think, the sentiments that we've developed over the last couple of weeks.
Thank you, Dr. Ross.
Thank you.
Thank you. All right.
Thanks for your time. Thanks to all our guests. Thank you, team.